Welcome to SVG-TV News for Friday, February 12th, 2021. I am Rochelle Batiste with the details. The first 5,000 doses of the Indian manufacturer AstraZeneca vaccine with their boosters were brought in on Thursday afternoon on a Regional Security Services RSS aircraft from Dominica. The vaccines will be administered under a national vaccination program, which is expected to roll out soon. In light of this upcoming voluntary mass vaccination exercise, our news team spoke with several Vincentians in capital Kingstown today who share their thoughts on whether they are willing to take the jab.
No, I wouldn't mind. But anything that you call a man Bill Gates' name, I am scared of it. Because I think he's just doing that to make money and have poor people suffering and die.
I don't think I need to take it. Well, for me, I don't think this life and this world is going to get back to any form of normalcy right now. But for me and my family, we definitely won't be taking any vaccine.
Tomorrow morning, I'm willing to take it. If it's something to save my life or to help me to assist other brothers and sisters in the community, I'm going to take it.
Christ had to come down and tell me to take it. I don't follow nobody. I am not going to take anything that I don't know about. They need to explain it properly to us.
No vaccine. You don't belong to our down here.
No, please. You no good.
No, I would not. Because I saw people in other countries take it and get sick, some even die.
To prevent any sickness, and I have a child, so yes, I will take it.
No, because I am a sick lady, so I cannot. I will have to select somebody who's sick like me, take it, and then recover. But if I see that, I will take it.
Yes, please. Because it is very useful for the corona, and I don't have no fears about it.
And SVG is slated to receive more vaccines in the coming days, after which the national vaccination program is expected to begin. The storage for the COVID-19 vaccines has to be at certain temperatures, otherwise they can go to waste. Here in SVG, the Ministry of Health, Wellness and the Environment has already procured refrigerators that can store items up to 2 to 8 degrees Celsius, which is what is required for the AstraZeneca vaccine. However, according to Chief Pharmacist in the Ministry of Health, Levi Walker, a refrigerator with larger storage was also purchased for the Pfizer vaccines, while the Sputnik vaccine will be stored at the Levi Latham Health Center.
Requirement for the Pfizer, we expect to receive 2 ultra-cooled cryogenic freezers, and these are capable of providing cooling temperatures as low as minus 90 degrees. Of course, these ultra-low freezers, they require special cryogenic gloves to handle the product. Essentially, we have made the provisions to handle all of the available COVID-19 vaccines regardless of their storage requirements. And considering that it is very likely that we would receive shipments of several, if not all, of these vaccines.
The storage and distribution of the vaccines would cover the entire population of SVG. According to Walker, approximately 400,000 EC dollars will be spent for additional vaccination-related materials, which will be placed at 4 health centers across the country.
Cryogenic gloves and voltage regulators, some syringes, and also we have in that as well 1 generator for one of the health facilities. We engaged 2 suppliers, one out of Spain and one out of South Korea. The shipment from Spain should be here early March, and from the South Korea supplier, those should be on the ground within a week and a half. The storage sites that we have identified so far include Bookman Polyclinic, Stuff Polyclinic, Kingston, nearby Latham Health Center, and the Union Island Health Center.
The U.S. Center for Disease Control and Prevention requires all organizations which administer COVID-19 vaccines to report the number of doses that were not used, spoiled, expired, or wasted as required by the respective jurisdiction. The quarantine time for persons coming into SVG fully vaccinated for COVID-19 could be reduced to 7 days. So said Chief Medical Officer Dr. Simone Kieser Beach during yesterday's news conference hosted by the Ministry of Health, Wellness and the Environment. As it stands, travelers to SVG, including returning nationals, are required to quarantine for 14 days at an approved Ministry of Health facility.
After having been completely vaccinated, so they've received their 2 shots if they're coming from the States, so they have gotten 2 shots of the Moderna or the Pfizer, so they have certification that they have been completely vaccinated. The consideration would be that you will still need to come with a negative PCR test. You will still need to have a PCR test done on arrival, and we would consider shortening the quarantine to 7 days.
The CMO said even with the vaccination program, quarantining is a must, as they will continue to take all necessary precautions to prevent the further spread of the virus in SVG.
The research thus far suggests that the vaccines, though they might decrease the possibility of being infected, they are not decreasing completely. So you can still be carrying the virus, and so you can still pose a risk to us. So the considerations, and as I'm saying, we are still deliberating, and we still have to be guided. But for now, you would still require the PCR test, a negative one to come in. You would still need to have one done on arrival, and you will still have to do some quarantine.
The country on Thursday confirmed 25 new COVID-19 cases. The National Emergency Management Organization, NEMO, said these positive results are for persons tested between February 10th and the 11th during contact tracing and testing of persons with flu symptoms. There are now 1,224 local cases of COVID-19. 68 persons were cleared, bringing the number of total recoveries to 535. 854 cases remain active, and 6 persons with COVID-19 have died. 1,395 cases of COVID-19 have been reported in St. Vincent and the Grenadines since March 2020. The public is advised that the use of masks in public spaces or private spaces to which the public has access is now mandatory under the Public Health Act 2020. The consistent use of facial coverings is aimed at reducing the spread of COVID-19 in the country. As financial pressure continues to rise for local omnibus operators, those plying the Georgetown route today suspended their services in protest of the current 8-person capacity mandated as part of the public health rules and regulations, which took effect last Saturday to help stem the spread of the COVID-19 virus in the country. In a telephone interview today with SVGTV News, President of the Vincentian Transportation Association, Roy Ron Adams, said the strike may be as a result of stressed out omnibus operators.
The position of Vinters has not changed. We've written to the government and we are awaiting a response from the government. In the meantime, our operators are under significant stress, and therefore the response that you're seeing in Georgetown is an indication that those stress levels are rising constantly every day.
According to Adams, electronic correspondence was sent to the Minister of Finance, Camila Gonzalez, and the Minister of Transport and Works, Montgomery Daniel, because he is out of state. He said while he is yet to receive an acknowledgement of his letters, Prime Minister Dr. Ralph Gonzalez contacted him today, and a meeting has been scheduled for Tuesday, February 16. Adams highlighted several recommendations the association has put before the authorities, which he said, if taken seriously, can go a long way in assisting omnibus operators during these difficult times.
We have called on the government to acknowledge the challenges that the minibus operators are facing. Some of those suggestions are the institution of a permanent subsidy for minibus operators. In addition to that, we need the government to consider moving the gas price downwards once more. Maybe now is the time for the government to consider providing a reduction to wholesalers on the levy so that they can pass on some savings to us as operators, and perhaps to the general public as we all face this pandemic together. We also ask for consideration some things that I know operators have largely been asking us to make representation on, which is consider waiving some of the traffic cases that are pending right now as it relates to picking up and dropping off passengers at places other than a bus stop. Some of the options that we provided, I think, can be instituted permanently and not just as we go through this pandemic.
Omnibus operators across the country have expressed growing concern over the reduction in passenger capacity to 8 persons and subsequent ticketing for breaking that regulation as the already impacted sector struggles to stay afloat amidst rising COVID-19 cases and tighter restrictions imposed on the general public and the transportation sector. The UWI Seismic Research Center's scientific team has increased its capacity to bolster seismic monitoring of La Soufriere volcano here in St. Vincent and the Grenadines through a donation of seismic stations and a telemetry equipment. The USGS-USAID Volcano Disaster Assistance Program recently donated equipment to build 4 seismic stations and radios to enhance communication. 3 of the stations are solar-powered installations with post-hole seismometers. The 4th sensor is a spider seismometer, a device that is designed for rapid deployment in high-risk locations where human exposure to hazards should be minimized. The USGS-USAID VDAP approved the donation after receiving a request from the UWI Seismic Research Center following the effusive eruption, which was first detected on December 29, 2020. The UWI Seismic Research Center instrumentation engineer Lloyd Lynch said this equipment is needed as it allows the scientists to densify the seismic network by placing them in locations where there are significant gaps, and the spider seismometer will fortify the near crater monitoring in the event of an escalated volcanic activity at La Soufriere. Enhanced monitoring should allow our scientists to alert authorities with sufficient time to activate appropriate emergency responses such as evacuations. And some rock samples sent last month to the UK for testing returned to SVG today. Lead scientist now monitoring the volcano, Dr. Thomas Christopher, said what was confirmed by the findings is that there are chemical changes taking place and the magma being emitted from the new lava dome is not the same as the 1979 eruption. Dr. Christopher said that they are still doing further analysis to determine what could potentially be the outcome of the current eruption.
Which is left over from a previous eruption, which gets erupted. And the consequences are very different when you think about it, because you would expect material that's been sitting in the crust for a while and losing gas to have less potential to be explosive than material that is fresh and coming from deep, which has more gas in it. So it's more in terms of looking at what or how this eruption may unfold based on what is it we are seeing. So it doesn't really give us an idea of timing of anything, but it would definitely give us an idea of potential in terms of what may or may not be possible.
Dr. Christopher said that it was also found that new lava dome's eruption has evolved and that there is more silica content, and said it is a concern at the moment, noting the potential for an explosion.
When you increase silica content, one of the things you increase is viscosity. What I don't know if the difference in chemistry is significant enough to change the viscosity between the 79 lavas and this one. That is something that we need to investigate further with more data. But I just want to stress that the viscosity of a lava has to do with how easy it can degas. So if the viscosity is low, it's easier for your lava to degas. If it's higher, then it's more likely to trap gases. And once again, gases are what drive explosions. So we're quite concerned about the explosivity at this volcano, because we know this volcano can generate explosions. And one of the things we want to do is to be able to have a handle on if we think or how high we think the potential is for an explosion, and then if possible try and find a way to be able to see them coming if they are coming.
Dr. Christopher said he and his team will be doing a dome survey, and once the weather permits, they will be setting up a GPS at Jacob's Well and at Table Rock. He said data will then be put together to analyze new measurements.
So basically, we do campaign GPS to fill gaps where the network is not filling. So hopefully by next week, we should have that data back from Jacob's Well, and we should be able to add more to the GPS story. And the plan is to also do a gas measurement as soon as the team gets back from the Georgetown area, because they will be in Georgetown as long as they're doing this. And when they're done, they'll come back here. Within a day or two after them coming back here, I will go to the summit, take another gas measurement, and hopefully do another dome survey. So hopefully within the next week, you will have 2 new dome survey measurements and the gas measurement.
Jamaican national Linford George Robinson, who pleaded guilty on Thursday for possession of an AR-15 rifle and 16 rounds of 5.56 Magnum ammunition, has been sentenced. Today, Friday, February 12, 2021, Chief Magistrate Ration Brown sentenced Robinson to a term of imprisonment of 5 years and 4 months for possession of the prohibited firearm and 2 years for possession of the prohibited rounds of ammunition. The sentences are to run concurrently. Robinson was also ordered to be removed from St. Vincent and the Grenadines after the completion of his sentences. Robinson was arrested by members of the Rapid Response Unit, the RRU, on Tuesday, February 9, 2021, in a police operation. Vincentians are being invited to enter the Embassy of St. Vincent and the Grenadines in the Republic of China on Taiwan slogan competition as they prepare to celebrate the 40th anniversary of diplomatic relations with Taiwan. Submissions for the competition can be made by individuals or groups of persons whose full names and social media handles must accompany the submission. The Agency for Public Information said individuals or groups of persons can submit more than one slogan. The winning prize of $400 EC will be awarded to an individual or to one group of persons. The winning slogan is expected to be announced on Friday, March 19, 2021.